doctors are at the end human beings. There are
Yeah.
emotions of distress, disease, death, helplessness all around them. How can
Yeah.
doctors separate emotions and work?
Labeling everything or personalizing everything, even if deep down you know that, okay, there is a rational side to it, that I could not do it because of this, not sleeping, and you fall ill. So then when you fall ill, you will be absent, you will not be there to help others. Then imagine how many calls will you be missing. To be more rational at times when you feel the guilt and everything is taking over you and you're not feeling too good about yourself.
Relative of patients actually started beating up doctors because of one reason or the other.
Dear healthcare workers, dear doctors, other healthcare workers, please take care of yourself.
Doctors are working long continuous hours in shifts which are as long as 24 hours in hospitals in very challenging environments, and they face burnouts, they face issues like mental stress, emotional stress, and so many other mental health issues. In this video, Dr. Lovleen Kaur is going to answer all the questions as a clinical psychologist on issues specific to the mental health of healthcare workers. Hello all, welcome to Doctor's Talk. Today we are having with us Dr. Lovleen Kaur is a clinical psychologist at Mind on Health Delhi, Indus Health Delhi, and at the School of Planning and Architecture. Today's topic is a very crucial topic, and the title of the topic is Mental Health of Healthcare Workers on the COVID Frontline. We all are sitting at home and trying to pray that COVID doesn't touch us. But doctors, healthcare workers are dealing with COVID patients on a daily basis, sometimes in 24-hour shift. And these people are dealing with issues they have no one to discuss with. So let's today take up this very important issue on mental health for healthcare workers. So ma'am, how are you this evening?
I'm very fine. Thank you so much. And I think that it's a very, very relevant topic which we have picked up for today, considering that how our frontline workers, particularly the healthcare workers, are being affected by the pandemic going on. So it's my pleasure to help in the way possible and maybe to reach out to them.
So ma'am, with this, ma'am, we'll just start directly with our first question. These questions have been asked by doctors themselves. So I'm just relaying these questions to you so that you can answer, and my doctors are going to see them. So the first question is, how to manage the feeling of loneliness in healthcare workers, staying away from their families to avoid the risk of infecting them?
Absolutely right. That loneliness is something which they have been struggling for almost over a year now. So we all know the reasons for them, like they have critical infection control strategies which they have to follow, wearing PPE kits and everything, being socially isolated, being away from the family, not being able to talk to them. So definitely all these things are going to lead to a feeling of loneliness. It is going to lead to other psychological issues as well. So I think the best way to